In 2009, the Ministry of Health, with support from a number of stakeholders, carried out indoor residue spraying in selected districts of northern Uganda. This greatly reduced incidences of malaria. The population heaved a sigh of relief when the insecticide worked against the mosquitoes.
People went to sleep knowing that malaria was practically fought off, and they were no longer using mosquito nets. They were no longer seeking care.
The malaria control program relaxed and did not follow the interventions closely, and before long, a whole population was affected with hundreds dying of malaria, which is a treatable disease.
But that brings another question, the question of whenever we bring down the problem of malaria, what do we do to engage households to take action to maintain the status quo? And much as we want to quickly bring down the epidemic, we are also working on how to avoid a repeat of the situation and get the best lessons out of this.
The new report by the Malaria Consortium's project, Beyond Gachi, shows that mosquitoes develop resistance to the chemicals used in indoor residue spraying. Resistance, if not monitored, results into an outbreak of malaria, like has been the case in northern Uganda.
But this resistance is not uniform. For example, in some of the tests we have carried out in the Apache district site of the study, we have found that sometimes the vectors are not resistant, but they show susceptibility to the insecticide, especially in the site where we have the indoor residual spraying.
You spray, you use insecticides in the nets, it will kill the majority, say 80% or 90% to start off. The 2% which survives multiplies, but when it multiplies, it's now the resistant type, and it becomes the majority. So that's why it's important to manage our programs well.
The study was carried out in Uganda and Ethiopia over a period of 2 years. In Uganda, it was carried out in Apache and Chankwanzi districts.
Even if the mosquitoes are resistant against the insecticides, sleeping under the nets protects individuals who sleep under the nets. And that is irrespective of the resistance. So our advice is for people to continue using these nets because we know that they can prevent infection.
Here, monitoring trends of malaria, epidemiology, and the impact of interventions was done. The Health Ministry has said that it will change the chemicals used in the spraying exercise from pendiocap to actelic. Irene Namialo, NTV.